Stevens, and I'm going to be talking tonight about the National Alliance for Mental Illness. Here is my audience. This is Mike, Dennis, Doyle, who is my husband, Ashley, Tanya, who is my sister-in-law, and Shane. My daughter, Beth, go ahead and turn the camera around on you, Beth. She's doing the filming. Okay. Anyway, I'm talking about the National Alliance for Mental Illness tonight. Has anyone ever received a phone call from a family or a loved one or a friend, or been sitting and talking with someone about suicide? Maybe somebody you know has committed suicide. I mean, have you ever thought about what you would do if your daughter or your spouse or, son, aunt, uncle called you up on the phone and all upset and depressed and told you they were going to kill themselves? You'd be upset, wouldn't you? You'd be frantic if it was one of your children or your spouse. The first thing that you would say to those people would be, don't do it. We'll get you some help. And when you say this, you're going to mean it with all your heart and soul, because you care about them and you don't want them to commit suicide. And then the next question is going to be, how are you going to help them? You're going to have really good insurance that covers suicidal tendencies or mental illness or things of that nature, or you're going to have a whole lot of money. And believe me, I know what I'm talking about, because my son is bipolar, my husband is bipolar, and I know people who are bipolar. So if you don't have insurance and you're trying to help somebody with a mental illness, you're in for a big expense. Basically what happens is you get on the phone, you start calling, you try to get them help. Get them into a mental hospital for an evaluation, some type of intervention. Those are, they're just through the roof. I mean, that's all I can say about it. I've been there. I know. Basically, what I'm going to talk to you about tonight is donating to a worthy cause, which is the National Alliance of Mental Illness. Now, I know anytime somebody asks you to donate your hard-earned cash, you start to get nervous. Don't like to say no, but you don't want to say yes. So, in order to try to persuade you to donate, I'm going to tell you why this cause is so important. The patients who have these mental illnesses, they don't understand that they have a mental illness. That's why suicide, is a dangerous thing for people who have mental illness. Suicide is the 10th leading cause of death in the United States, and that goes up to the top 3 for teens and young adults. And there's all kinds of signs and symptoms that you want to look for. Depression, isolation, substance abuse, all those things are contributors to suicide. But like I said, you can't do anything to help these people if you don't have insurance and you're not rich. So that's where the National Alliance for Mental Illness comes into play at. As I told you before, my husband and my son are both bipolar. My son has really given us problems for the past, I'd say, 6 to 10 years. He's attempted suicide twice. He's threatened it a whole lot. He's had problems with substance abuse, which goes along with mental illness. I've also worked at a mental hospital. Some of you may have heard of it, Lakeshore. It's closed down now. I've done endless research on the subject, and I'm also currently going to school to try and be a mental health counselor. My goal, though, tonight is to convince you all to donate your hard-earned cash to the National Alliance for Mental Illness. I'm going to do this by showing you some statistics about suicide rates in the United States. I'm going to tell you what they're going to do with your money, and then I'm going to tell you how you can donate. There's 30,000 people that try to kill themselves in the United States alone each year. I've got a chart here. I'm going to pass this around, and I want y'all to glance over it. It just shows the number of suicides by method used and the number of suicides per diagnosis. And all these diagnoses are mental health conditions, mental illness conditions, rather. Now, AMI, which is what it's called in short, the National Alliance for Mental Illness, serves, what its purpose is to serve as an advocate to mental health patients and their families. It works diligently to find these patients the help that they need so they don't get into this situation. There's a great need for help. There's a great need for donations. There's 1 million suicide attempts per year in the United States alone. I mean, I don't know if y'all knew that or not. That's a high amount. They help in other areas. Also, they help find mental health patients legal help. You might have a Social Security claim that you're trying to get for your loved one that's mentally ill to help them have some income. They help with employment. They help with housing. They help with food and clothing. They help with transportation, counseling. They help get the meds for free or low cost, and they also help protect the patient's rights, because a lot of people try to take advantage of mental health patients, and they need legal help. They work in communities all across the United States. They work with government to raise awareness, to advocate. And the next question, I'm sure, is all in your mind. I want you to donate. How much is it going to cost you? Well, you can become a member of the National Mental Alliance Association. You can become a member for $35 a year. That is at the national, state, and local levels. You get benefits with this membership. You're not just donating $35 and it's going to end there. You're going to get a monthly newsletter to inform you about what they're doing with your money, about mental health issues, a whole range of things, and other ways you can help and support the group. You're going to get discounts. You're going to become a member of an online community where there's a blog, a chat room. You can learn more about mental illness. If you're having problems with someone in your family with mental illness, you can learn about it through others who've been there. Or maybe if you've got anything to offer to someone who's going through it for the first time, you can help them. That's a good thing. All right. I've informed you of the statistics. I've told you how your money will be used, and I've shown you how you can donate. I just want to say what an extremely well-deserved cause this is. I want y'all to please consider donating to this cause, because it's a really good one. It's one that doesn't get a lot of attention, and like versus the National Cancer Society.